Lamictal was initially made to help with seizures, but this medication has also helped with mood, in particular in depression and people who suffer from bipolar disorder. I like Lamictal as a mood stabilizer because there's not many side effects to it. Like, it's not sedating, there's not weight gain, and it does not require much blood monitoring. The main problem with it, which is not an issue typically in an outpatient setting, but more of an issue uh, in an urgent or emergency situation for mood control, is that this medication can take weeks to have an optimal effect. There's a risk of a rash with the medication, and this rash can get so severe that the skin can begin to peel off, leading to not just pain, but more chances for infection, and people can even die from it. It's relatively rare. Maybe one person out of every 3,000 or one person out of every 5,000 on this medication will get that rash. But it's pretty severe enough to where the dosing is adjusted accordingly. Children and adolescents are more susceptible to this rash, and also people who are on a medication called Depakote or valproic acid. So it should be avoided. It should be avoided if possible when in someone taking Depakote. Depakote is shown to double the concentration of Lamotrigine. So to minimize the chance of this rash occurring, it started at 25 milligrams for 2 weeks, and then it's increased to 50 milligrams for at least another 2 weeks. After that, you're at 100 milligrams. That can be helpful as a mood stabilizer, and you can go up on the dose a little bit more quickly from there. The maximum recommended dose for bipolar disorder is 200 milligrams, and typically higher doses than that are more for seizure control. People with personality disorders or as a mood stabilizer for conditions such as post-traumatic stress disorder can use it at smaller doses. How does it work? Well, it seems that it blocks sodium channels in the body, which then affects the calcium channels in the body, and that affects the release of glutamate and aspartate, and it's also shown to slightly increase the levels of serotonin in the body. The side effects from it, again, are not as severe as a lot of other mood stabilizers, but most commonly it can be dizziness, can affect walking, can cause fatigue, headaches, blurry vision, or nausea. Although the possible list of side effects, given it affects the brain and nervous system, can be quite extensive, but can also include meningitis, liver failure, suicidality, and affect the bone marrow. If you found this video helpful at all, please subscribe. It can help the channel to have more videos of this nature.